Hello, everybody. We're just letting people in to the waiting room. When I scheduled this lecture, I had everyone mute on arrival. If you could just double check that you were on mute, that would be fantastic. And can I get a thumbs up to make sure that you can hear me well? Thank you. I got a thumbs up. That is fantastic. Thank you very much. We'll just let a couple more people in and get going. Dr. Evan and I were saying the last time it was beautiful and sunny and still daytime. Now the sun's going down very quickly. Not ready for this.
It's too fast every year.
Yes. Okay, I think we could get started. Welcome tonight. This is the first of Dr. Evan Steinke's 4-part lower extremity webinar series. The topic for the evening is glute pain versus SI pain. To those of you who have been with us in previous webinars or lecture series, welcome back. We appreciate your time. If this is your first AST webinar lecture that you have attended, we welcome you as well. It's great to see new faces. Thanks to everyone for joining us on this beautiful evening. Your time and attention is not something that we take for granted. I will start by introducing myself. My name is Renee Westmacott, and I will be your co-host for the evening. I'm always standing by for any questions that might come up. If the questions are relevant, I will interrupt Dr. Evan. If not, we will review the questions at the end of the lecture. And if you prefer to ask them in person, just stay on for the Q&A at the end. Let me share a little bit about Dr. Evan Steinke. Dr. Evan Steinke joined the AST Westman chiropractic team at the beginning of May 2020. Dr. Steinke brings a wealth of knowledge to the AST team, and we are thrilled to have him. He has a great understanding of how to connect with patients and put their needs first. You can book in with Dr. Steinke at AST Westman only. All the contact information will be available at the end of the lecture. That's all from me. Please join me in welcoming Dr. Evan Steinke.
Thank you, Renee. I appreciate that. Can you hear me okay?
Yes.
Awesome. Okay. So yeah, I've been with the
Welcome.
AST team for a little bit now, and it has been fantastic. I've really enjoyed my time, and I've been enjoying doing these series with you guys as well. So today is part 1 of a new one. We're going to be doing the lower extremity today. And the first topic I knew I had to cover was the sacroiliac joint, also called the SI joint. And that's because it's something I see pretty much every single day in clinic. It's just a constant source of pain for a lot of people, but it's not talked about a whole lot. So I wanted to kind of cover it, go over the anatomy, and just explain what's going on. So let's do an overview first. So I'm going to cover the anatomy, just some basics. We'll go over kind of the bones that are involved. We'll cover the ligaments and the muscles, and then I'll cover the most common injuries of the joint. And I'll include some specific ones that even are more unique to this area of the body. Treatment and management plans. So that's what I can do as a chiropractor to help you overcome this with, exercises and strengthening and adjustments, and I'll dive into all of that as well. Beyond that, there's the prevention. What can you do ahead of time if you don't have any of these symptoms to help? And if you do have them, what kind of home care and exercises, stretching, all that stuff can you do if you've already got it? So we'll be covering that. And of course, if questions are coming up along the way, you can type them into the chat. Just make sure that you have it going to everyone so that Renee can read it. And she'll either interrupt me or you can ask at the end. My qualifications are, I have a bachelor's of science in human biology from the University of Western States. And I also am a doctor of chiropractic from the same university. So let's dive in. What is an SI joint? It's this one highlighted right here in red. It's at the back of the pelvis. So just to orientate ourselves, if I highlight the lumbars in green, that's the very lower part of your spinal column, okay? So the weight that is transferred through the spinal column goes down into the lumbars, and then it's passed on to this wedge-like shape here. This is your sacrum, okay? The very tip of which we call your tailbone, okay? So that's the sacrum. And then on either side, these kind of ear-like shaped bones, that's the pelvis itself. That's called your ilium, okay? So between the sacrum, the S, and the ilium, the I, you get your SI joint, okay? So it's smack in the middle there. But I want to show you kind of where on the body this is, because it's often confused with the hip joint and such. So if we look on the left, we have a female body. On the right, we have male. If we follow the spine of the female down to the bottom, you'll see just above the buttock, there's two dimples that are off center right here, okay? That is created by a bony prominence that sits right over top of the SI joint. So that basically indicates exactly where your SI is starting, okay? And then if I overlay an image of the pelvis on top of this, you can see that's exactly what is happening, okay? That's right where the joint is starting. If we jump over to the male side, I highlight the entire length of the joint. So it is actually quite a large joint in general, a couple centimeters at least. And if I remove that again, you can see, right, it's not out on the side of the body. It's just a couple centimeters off of center on either side. Okay, and this is why I included this in the lower extremity series, because SI pain can refer all over the body, okay? So on the left, we have a bit of a heat map of where the pain can refer to. So it can wrap around to the front of the body into the kind of the groin area, right between where our leg meets our torso. And it can also travel up into our lower back. It can travel all the way through the glutes and down the legs. So for you know, a medium-sized joint, it can cause significant pain throughout the body. And then here, I just want to help everybody kind of, again, differentiate between the SI joint and the hip joint. So I'm going to help you guys find some of these landmarks. The first one we're going to find is what we call the iliac crest. This is that red bony ridge at the top. So that top dashed line, that's where you would see like your belt sit, you know, back in the day when everybody wore their pants up nice and high, of course. When you wear them nice and high and you put your belt on, that's where that should sit. So if you guys can see me, I'm going to stand up here. If you follow the side of your rib cage down and you just slowly press in, you'll feel that there's suddenly nothing. There's no bones at all. And then if we go down a little bit lower, there's going to be a bony ridge. And that's right where the top of the pant line comes in, okay? That right there, that bone, that's the red one I've highlighted. That's your iliac crest, okay? And if we follow that back, kind of where these straps are almost, that's where your SI joint is, off center, okay? And that's different from our hip joint, which I've highlighted in yellow here, right? So if you think about the hip joint, that's the one that gives your leg all that motion. It's a ball and socket joint with tons of movement. And the outermost part of that bone is what we call the greater trochanter. And that's what I've highlighted in green. Okay, so if you think of it like a, you know, classic kind of hourglass figure in a woman, this is the most wide that the hips get. Okay, but that's actually from the femur and not really where the SI joint is. So just, I hope that helps differentiate where an SI joint is from where a hip joint is. Okay. So let's talk about what that joint really looks like. So again, on the left, we have the sacrum and the ilium. And if we were to take a kind of a cross section and look at that from the side with an x-ray, we would get what we have on the right side here. That big red boomerang-like shape, that is the joint surface. It's really quite a large joint. It takes up a big portion of that bone. And you'll see that inside there's a little arrow pointing kind of back and forth. So it does have some amount of rotation in it. And if you follow that down to where the tailbone is, you can see, again, I put a bigger arrow on top of it. There is some amount of rotation, and that's allowing for your tailbone to slide in and out, okay? So it is a functioning joint. It's not fused, okay? There is movement in there. So why is it so important, right? We're doing a whole seminar on this. So why is it so important? The first reason for that is its location, okay? It's located at the back of the pelvis, in front of what we would call the pelvic bowl. This is that round cylinder shape that's created by the pelvis, and a huge number of really, really important structures passes through that. So some of those are on the right side here. Your bladder up front, in females, your uterus is going to be in here. The GI tract going towards the rectum is in there. Your blood supply. So you can see at the top there that red artery coming down. That's actually your aorta. That's the very end of your aorta before it splits and goes to either leg. So even important blood supplies are right next to the joint. And you can see that there's just a huge, huge number of nerves that are passing right over top of it. And it's this one that I'm highlighting with a red arrow here, okay? That's the SI from the front view, okay? So step one, why is it so important? Definitely because of its location. There's just so many important structures passing right by it. The second reason is weight distribution. It's what we would consider a keystone, which is an architectural term, but essentially the keystone is the centerpiece of an arch that distributes the weight to either side. If you imagine the pelvis like an archway, then the sacrum is the keystone, and either side of it is your SI joint. So imagine all the weight from your upper body, your head, your arms, your torso, and your abdomen, all your organs, all that weight is getting carried on your spinal column, which is resting on top of that sacrum. The sacrum then redistributes it through the SI joints around the pelvis and then again into the legs. So constantly there's a huge amount of weight being pushed through this joint. That means that if any time we do injure it, it's hard for us to avoid even putting weight on it because we're constantly needing to load it. So let's put this into perspective. Let's look at some statistics. In patients with low back pain, 15 to 30% of them were found to have the pain start in their SI joint. So a significant amount of patients are finding that their low back pain is actually originating in the SI joint. And if there's fusions, like the bones are actually physically fusing together in their lumbars, then that rate increases up to 43%. So it really is a joint that we have to consider whenever somebody comes in for low back pain. And without a doubt, this is why, I treat this joint every day, because it is so common to have these issues. And then again, on this image, we can actually see the joint surface. It's kind of an odd shape, right? Like it's boomerang-like, and then there are some actual kind of raised ridges within it. So really a unique joint for the body. So how do we end up actually injuring this area? Well, the first one is pretty straightforward. It could be a direct trauma. So for example, a slip and fall is pretty common, especially in winter here with ice. We definitely see those. And what happens with that is if you land on or near the joint, you're impacting the two surfaces together. That's enough to cause inflammation, irritation, and pain from that. The other possibility is you're generating like a shear force where it's trying to rotate, but we're over rotating it more than what would typically be allowed. And I should have mentioned this before, but we're really only seeing like 4, maybe 5 degrees of rotation on an SI joint. It's very limited. It does move, but it's very limited. So if we suddenly fall and we're trying to force, we're pushing it towards 10 degrees, that's an exaggeration, but you can see that shear motion could cause injury. Some of the other things that can do this would be posture and ergonomic issues. So you can imagine with lots of sitting, lots of desk jobs these days, that you're creating a chronic muscle imbalance. And this probably wouldn't be apparent right away. This would be you come in after a year of switching to a desk job, and now suddenly your lower back is starting to hurt. It could be because it's starting to pull that SI joint out of place. And then lifting, it doesn't always have to be heavy lifting, but lifting more than you were expecting, right? So an unguarded movement. So say you went to pick up an Amazon delivery box or whatever, you go to lift it up. It was way heavier than you thought, and bam, you get pain through the SI joint. And then also for some people out there that like to do weight training, it's not so much that the heavy weight that's causing the injury, it's if you have a poor form. So perhaps your core wasn't engaged, or you weren't, your back wasn't in the neutral position when you went to do a lift. That sort of stuff can all lead to the joint getting injured. Okay, beyond the kind of ergonomic and the biomechanics of injuring a joint, there are diseases that affect it, right? So this is an extreme form called Ankylosing Spondylitis. It's an inflammatory disease that causes bony fusion. And I mean, it can cause serious bony fusion. And this is an example in the image. This would have been decades to get to this point, but basically what happens is the body starts to fuse the joints together, and it typically will start in the SI joint, which is why I'm mentioning it here.
No cure, treatment based on slowing.
Sorry, what was that? Was that a question?
No.
Oh,
Oh, hi, George. I do think I see that you're not muted. Do you mind if we put you on mute?
Sure.
Okay, thank you.
okay. If you guys do have any questions or you want me to slow it down or anything, please let me know. So what I was saying is this is a condition that is nearly twice as common in men. So we'll usually see kind of a young adult come in, maybe 20s or usually before 30, with low back pain. We'll usually try conservative care, and we'll see that it's slowly progressing, right? And as it starts to go up and up and up in the spine, you can see it even gets into the ribs, and it just fuses everything together. There's no cure for this. Our goal is to simply keep as much movement as we can in the meantime, okay? So let's look at some x-rays of this. On the left, we have what would be a healthy skeleton, and on the right, we have ankylosing spondylitis skeleton, and that's sometimes referred to as bamboo spine because of the image that appears on the x-ray. It looks a lot like bamboo. On the left here, if we look at the SI joint at the bottom, I'm pointing a red arrow to it. You can see that vertical translucency, that's the literal gap between the joints so that it can move, it can swivel on either side there. When we look on an ankylosing spondylitis patient, it's not there. There is no vertical translucency because it's completely fused together. So this person would have no movement at all through there. And in this case, it's pretty extreme. So if we look even higher, this case, it's already progressed. We should see this kind of translucent gap between each level, but here we see these kind of what we call osteophyte, these bony calcifications. It's fusing everything on the way up. And even in the front view, you can see it. It's joining everything together. So that's another way that conditions can affect this joint. It's not to say that the joint can't get fused at all. So this is a study that was done to just see if the general population, if that joint was just fusing by itself. It's relatively like small, the study. There's 159 males, and I think there's 128 females in the study. But here's the premise, the takeaway. In males, age 20 to 39, they found about a 6% rate of fusion, and in females, 0. So it seems like males start to fuse earlier on in life. But if you jump to the 60 to 79-year-old age category, the fusion rate in males was already up to 31% and 0 in females. So again, small study, these numbers are probably kind of more ballpark than precise, but it is an interesting study to see that, so there's some of us that are walking around out there with fused SI joints, and probably a lot more males than females. So what's the next layer after the bone? Well, it's the ligaments. This is the connective tissue that holds absolutely everything together. It is this thick, strong, fibrous, and it really does. It looks white, just like this. It holds everything together. And you can see that the pelvis isn't something we want a whole lot of movement through, and the body has done a good job of pretty much just blanketing this thing in ligaments. They are everywhere. For the most part, these don't get injured a whole lot because there really is, only a few degrees of movement. We're unlikely to injure them. It does sometimes happen, and it's usually this guy right here. So this is kind of two ligaments coming together called the sacrotuberous and sacroiliac ligaments. Name's not super important. Typically, a fall might injure something like this. Self-limiting, rest, a little bit of pain management, and then some strengthening through exercises would likely result in restoring all the strength to that joint so that it doesn't get injured again, okay? Sometimes this will feel like pain right in the center of the buttock, and sometimes it does refer down the leg as well. Kind of depends on the case and the scenario and how you actually acquired this injury. But again, ligament injuries, not very common. So we're going to dive into muscles. Now, this is kind of the bread and butter of this presentation. This is the most important part. Pelvic posture is something that I have to stress as being really critical to people's health that is far too often overlooked. And it starts by understanding the basic principles of the core muscles and what is moving your pelvis. So I've broken it down. There's a lot of muscles involved here, but the names aren't important. The functions are a little important, but really it's the premise of how we're rotating the pelvis. So I'm going to break it into 4 categories. The first one is your core muscles. So this is your abdominals. Your abs, when you contract, they're going to be pulling up on the front of that pelvis. And core strength is typically something that just the general population's lacking. We usually don't have enough core strength in general. If we look below the pelvis, on the same side, we have our hip flexors. So that's going to be stuff like our quads and our iliopsoas. And don't worry about the names again. I'm going to show you all of these individually. The lower back muscles on the back, so that's the opposite of the core. It's going to pull up on the other side, bringing that tailbone upwards. And that would be stuff like the paraspinal muscles, these big, thick postural muscles running up and down the spine, and then the quadratus lumborum. Again, I'm gonna touch on that in a second. And then on the back side of the leg, we have the glutes and the hamstrings, and that's going to counteract those lower back muscles by pulling that tailbone down and in. So let's dive into each one of these 4 categories. Again, the first one is those core muscles. This is on the front. In the image on the right, it's the front one with the red arrows are pointing. And for more or less, if these contract and they shorten up, you're tilting the pelvis towards the back where that green arrow is going, okay? There's 3 main abdominal muscles in the front. They all have slightly different fiber directions so that we can get maximum strength out of them. But again, the premise here being that if we contract these, we're tilting the pelvis posteriorly. Okay, and then if we look below, we get those hip flexor muscles. Okay, so there's a huge number of these. The big strong one that a lot of us use to raise our hip up for the most part is this one I'm pointing the green arrow to. This is called your iliopsoas muscle, okay? By itself, known for causing a lot of low back pain. So this one could probably get its own lecture, to be honest. The main function of that muscle is to raise your hip up when you're, say, going upstairs. But if your foot was planted and your leg's not moving, when you contract it, it does the opposite. It tilts your pelvis forward. So imagine if you had a really strong, tight quad muscle, your pelvis would be kind of stuck pointing anteriorly rotated, looking down towards the floor. So this is often a muscle group that I like to stretch on people so that we can improve their posture. One of the other ways to look at this is if the hip is already up, you can see all of these muscles reaching from the low back all the way into the hip. So it really is, it's a series of muscles. The takeaway is if they shorten, they're leaning the pelvis forward. Okay, if we shift over to the back side, we have those postural muscles into the back called the spinalis, the longissimus, iliocostalis, again, names not worth remembering. What is worth remembering is that if your low back is really tightening up, imagine it pulling up on that tailbone, right? It's tilting your pelvis forward, really similar to what we were just looking at, right? So when these ones contracted, when they're on the front, tilting the pelvis forward, it's compounded by the lower back also being tight and stiff, okay? And again, the quadratus lumborum, this one, something we treat all the time. Dr. Dave, I remember he taught me how to stretch this muscle on people, and I use this like every single day in my practice. A very tight muscle on a lot of people. Okay, so the last group, the posterior legs. So this is going to be your glutes and your hamstrings. Lots of muscles in here again. The glutes, a lot of people are familiar with, right? So this is what's pulling your leg posteriorly. So once you take a step up, it's what returns your leg to that neutral position. But imagine if they're tight all the time, those hamstrings are pulling down. Again, you're tilting that pelvis backwards. So now we've kind of laid the groundwork for all of these different mechanics for tilting the pelvis. Some are forward and some are backwards, okay? And then on this other image, this middle image, I did want to note that, again, you can see that all of these structures are working in unison. That red highlighted one was the same ligament I was talking about before that could get injured. And then you can even see to the right of it, that's the sciatic nerve. And we'll be talking about that one in a little bit. So all of these structures are interrelated. They're not as separate as I'm making them out to be, but it's just easier to learn that way. Okay, so let's take everything that we just learned and take a kind of an overall view, right? The core and the abdominals in the front and the posterior legs, those glutes and those hamstrings in the back, they do the same thing. They rotate the pelvis, okay? When they're contracting, they're rotating it backwards. Okay. Then we have the opposites. We have the hip flexors in the front and we have the lower back muscles in the back. When they are tight, they rotate the pelvis forward, okay? So they're working in counterbalance, but that's how these work. The lower back and the hip flexors are working together, and then the core and the posterior leg. Okay, the most common condition that results from this imbalance is what we call anterior pelvic tilt. And it's exactly what it looks like here. Instead of sitting in this neutral pelvis, we start to lean forward. We get our belly sticking out, our back arching, our butt kind of sticking out again, and we get that line pointing towards the ground. So this is pelvic tilt, okay? Specifically anterior pelvic tilt. So how did we get there? Well, on the left side, the neutral pelvis, we have this perfectly horizontal green line. Imagine your belt line, right through there. If the short and tight muscles in the low back and the short and tight muscles in the front are contracting, then we go from that neutral position and we start to deviate. And over time, this is building up, building up, building up until our pelvis is fully tilted forward, okay? And as a result, the other side of things, the core and the glutes, those are weakened. Those are not as strong. And this is what we call anterior pelvic tilt. And it is constant. Now that you know about it, you will see people in the grocery store just waiting in line and they will be in this position. You might even think, man, I've caught myself in that position because I know I do. I catch myself in this and it's a constant struggle to correct it. So again, this is what it's looking like, that excessive back arch. This can cause back pain by itself, like easily. I treat people for this. Your belly is sticking out. It's kind of hanging over your feet. And then again, the butt sticking out. Okay. So how do we manage this? Well, step one's done. You're aware of it now, right? Knowing is half the battle in this case. So setting up reminders to correct your posture, to try to tilt in. And I'm going to show you in a second how to do this. But setting reminders on how to correct your posture and then avoiding triggers. So often sitting is a trigger for people to kind of let their core muscles go and they kind of start to slouch, and then when they stand up again, they're in a poor posture. So, reminding yourself after each one of these events is a good way to start. Finding and correcting your posture. It's helpful to do things like this, attending this lecture. You might be able to find it by yourself, but if you can't, just come visit us, come see a chiropractor, come see a physiotherapist, and have your posture evaluated. And then once you know what's right, practice it, do it in a mirror, and just make sure that you're constantly correcting the postures. Strengthening weakened muscle groups. So typically, as I was talking about, that's the core, right? General population just doesn't have very much core strength. So we want to improve that. We want to improve glute and hamstring strength. And then we want to stretch those short and tight muscles. So that would be your quad and your lower back. So the first steps to correcting this would be something like a quadruped. Okay, so this is a really great exercise that helps not only with glutes, but mostly this is focused on your core. Okay, so what you do is you could just grab like a yoga mat, or if you have a carpeted floor, it's easy. You go down on your hands and knees, and then you're going to raise one arm and one leg at the same time, and you're just going to stretch out just like she's doing here. And that helps to build the strength in the core so that you don't have to let it tilt and hang forward. And actually, I think it might be just really helpful right now if we all try to stand up and actually and do this, right? So everybody can kind of experience it. Okay.
Can I ask you a quick question about this
Sure
one?
can.
Just for balance, do you want to raise the opposing leg to the opposing arm, or is it the same? Okay, perfect. Just to clarify.
You want to do opposite for balance purposes. So if you raise left arm, you're going to have to raise right leg. Otherwise, you're doing a different exercise and it's way, way harder. Okay, so if you guys can, if you have space, let's stand up. Okay, so if we face to the side, I'm just going to move my chair here. Okay. So if we stand to the side, imagine your belt line through here, right? And everybody can kind of make a cup with a C and just put them on your hips, right where that bone was that we found earlier in the lecture, iliac crest, okay? Now you can imagine that if you're sitting in kind of a poor, what we call an anterior pelvic tilt, you're gonna start to tilt down. So it's not leaning forward, it's not leaning back, the butt sticks out and the belly hangs forward, right? So you see that? My hips are pointing towards the ground. And do you see how much extra arch there is in my back now? That, for me, I can already feel, honestly, the low back pain with that. So how do we correct this? Well, we want to contract the core. So we're going to pull up with that, and then we're going to squeeze those glutes in, and now I'm flat again. Okay, so that's really good. We can even go further. If we squeeze even more and point, do you see how my hips are pointing up now? That's extreme. We call this posterior pelvic tilt, but almost nobody gets this. It's pretty rare to have this. So let's try the extremes again. So from neutral, horizontal with the ground, okay? We're gonna let our butt stick out and our belly hang forward. That's the anterior pelvic tilt. We wanna try to avoid this. It's too much pressure on our low back. So what are we gonna do? We're gonna squeeze our glutes forward. We're gonna pull our belly button in, and you're gonna get to that horizontal level right there. Okay, so that's the neutral pelvis that we're aiming for. Okay, does anybody have questions or concerns about that? Okay, I think that's
I just have something to add to it. Maybe that's something, when you're standing, I'm going to hop back up at the grocery store, or, in lines. That awareness, would you say is a good, like, where's my hips, where's my body?
Yeah.
How can I improve?
Exactly. I would say that awareness is key, because expecting yourself to just kind of learn it and then go out and do it is unrealistic. Every time you sit down and stand up, you'll probably start to realize like you immediately lost that posture. So if you see somebody out in public doing it, that's your reminder. Oh yeah, let me check. Or, oh, I got to the grocery store line. Exactly. That's when I want you guys to start correcting this posture. And I always tell when I teach my patients this, I go like, as soon as you get home, you're gonna get out of your car and you're gonna walk to the door. But both on that like walk to the door, I want you to correct it, because by then it's been 20, 30 minutes, however long, you need to address it again. It needs to become a habit. Yeah. Okay, so we're gonna go back into some of the ways to address this muscle imbalance with exercises and stretching. So again, the pink ones on this image, those are the weakened muscles. So improving it with strengthening exercises like that quadruped, great start. Okay, if that one's a little difficult, you could try something like a plank. That would be a good start too. You can even just start from your knees. Okay, so just a knee to your elbows and start with that. Progress to a full plank, and then you can try these. Okay. The next one, those other weakened ones are down on the glutes. So how do we strengthen those? We do something called a bridge. Okay, so again, you can just lie down. You can even do this one in a bed, although I do find like a slightly more firm surface is easier on my neck. But lie down on a yoga mat, carpeted floor, and then you're gonna raise your glutes up until there's a straight line from your knee to your hip to your shoulder. So just like she has here. Okay, and what you're doing there is you're engaging those glutes and those hamstrings to raise your butt off the floor, and that's going to strengthen them. Okay, so those are the weakened groups that we want to correct. Well, what about the short and tight ones? Well, we want to stretch those. So how do we stretch the quads in the front? That's as easy as just doing one of these standing stretches, or if you really want to get in there, you can get a strap or a belt or something and kind of pull it over your shoulder. Depends how vigorous you want to go with it. Starting with this standing posture is a great way to begin. Okay, when you do the standing posture, just a couple notes. Okay, we did a stretching seminar with Olivia recently, and she was talking about this, and I just thought it was great. So when you go to do this stretch, okay, if it is tight, people tend to leave their butt out. Okay, I do want to encourage that you push your butt forward so that it's nice and straight here, and then you bring the hip up. Okay, if you're doing this, you're cheating a little. You're cheating yourself out of a good stretch, right? So really push that hip forward and then add it in. Okay. So that was the quads. And what about the low back? Child's pose. This is one of my favorite stretches. Personally, it's so great. Key here is when you get on your hands and knees, sink your butt down as far as you can on top of your heels. That is where a lot of the stretch is coming from. So if you just go on your hands and knees and just try to reach forward towards the, ahead of you, you might not feel it. Really sink the butt down and then reach forward. Okay, and you should feel that pull right through either side of your back. Okay. So next is nerves. We've covered the joints. Let's talk a little bit about nerves. There's a lot going on. There is a lot of nerves in this area. We have not only the lower back, but we also have the sacral plexus. So basically just a gigantic bundle in here. So let me just dissect it. We're gonna simplify this whole thing. We're gonna talk about the sciatic nerve, which is the thickest bundle of nerves in your whole body. It actually ends up being about as thick as your thumb. It's quite big. It's this one in the bottom that I highlighted in red. But you can see that it is stemming from a bunch of the smaller nerve roots that are coming from higher up, right? So from the L5, the S1, all of those are coming in and contributing. And again, they're passing right over top of that SI joint. So that's why this is so important. This is just a slightly different image to show you. They've color coded it here. So you can see that the sciatic nerve down here just stems from many different levels, again, passing over the SI joint. So what exactly is sciatica? Well, it is pain that travels along the sciatic nerve. So causes for this could be, there's a lot of causes. Nerve compression is probably the most common. So that could be a muscle compressing it. So some of those glute ones that I was showing you before, if those were really tight, they will compress right on this nerve and they can trigger it. One of the most common ones is called the Piriformis Syndrome. Piriformis Syndrome is when the piriformis is so tight, it literally squishes this sciatic nerve up against the bone and causes these symptoms. Some of the other ways are bony pressure. So imagine that ankylosing spondylitis case that I was showing you before. With everything fusing around those nerve roots, you're bound to have some symptoms, a lot like this. Osteoarthritis and other conditions can also cause that. Disc herniations, again, pretty common to have a disc herniation where literally the fluid inside is getting pushed out and there's not much space for it to go. So it ends up pushing on a nerve. And again, you're getting pain down the leg. You might be getting numbness. You might be getting tingling or weakness. Bowel or bladder changes can occur. If you're getting those last ones, the ones that are listed at the bottom, I put a little red flag next to those. If you're getting the numbness, the tingling, the weakness down the leg to the toes, that sort of stuff, or bowel or bladder changes, those are red flags. You need to go see your doctor, okay? Get an evaluation, because there are more serious conditions that need to get rolled out in that case, okay? So just kind of a warning for everyone. Last thing that can cause these is just chemical irritation. Again, a slip and a fall, it's swelling, it's inflamed. It can cause some of these symptoms down the leg. Okay, so that pretty much covers kind of an overview of sciatica. We will be getting it more into depth into some of the other lectures, so I don't want to do it all right here. The other joint I did want to mention that was on a lot of these images that we didn't talk about is the other joint of the pelvis, which is the pubic symphysis. So it's this one smack in the front here. Okay, so imagine all the weight that's getting distributed around the pelvis. It also goes through the front joint. Now, this joint it's not so much of a joint. Honestly, it's more of a joining. It doesn't move a whole lot. It's really just to connect the two pieces together. But there's a lot of structures that can press on it. And by far the most common one that presses on it is actually a fetus. So in women that are pregnant, the head of the baby, or depends on its orientation, but the head of the baby can press right on this. That can be really, really uncomfortable, and you can get some pain and symptoms. Oh yeah, so sorry, I'm pointing the arrow to it now. You might get discomfort or pain along the front of the pelvis, and it might even refer towards the back over those SI joints, into the low back, into the glutes. And again, most common cause for this is actually from pregnancy. There are other ways to do that. Some really strong spasms of the lower extremity muscles can cause it to shear a little bit and cause pain in it as well. So definitely males can still get this. So how do we manage SI pain at our clinic? Well, there's a lot of different methods, but these are some of the most common ones that I employ. Adjustments are what we see in that image on the top right. And they're pretty much coupled with mobilizations. An adjustment is more of a rapid force to move a joint, whereas a mobilization is just kind of a slowly rocking back and forth until we get the motion we need. Both of these are aimed at two things. One is to correct any joint movement that should be there that isn't. So for example, if your right SI feels like it's stuck, it's not moving at all, we should still get a couple degrees of motion. I might employ one of these methods to get it moving again. And then the second thing is if the joint is completely out of position, what we call a malposition, then we can correct it with these as well. Okay. The third thing is probably, I think, the most important is addressing your posture and your biomechanics. Like we just spent a long time explaining how important those muscles are in your posture. And if I just adjust you and send you home, and then you're going to stay in anterior pelvic tilt all day, we're not addressing underlying cause. So I think that's definitely one of the most important parts for everybody to address. Okay, so what is causing you to come out of that position? Is it your mechanics at work, at home, how you're doing your activities, that sort of stuff? Soft tissue work, clinic's really known for that. So muscle release technique or active release therapy. These are techniques to either remove tension in muscles or help relieve pain in them. So we use these really frequently every day. And then lastly, we have some modalities. These are not as used on SI joint pain, I'd say. It's more of a rarity, but we do have them available, and in some cases we would use them. So that covers everything from laser to interferential current, ultrasound, game ready machines, all of that. So you've seen that probably on my lectures before as well. So it's always an option for us. Okay. And then prevention and home care. So what can you guys do at home? Well, prevention would definitely be kind of the awareness component, right? You're aware of the posture that can set off SI joint pain. So let's start to work to avoid aggravating it any more than it needs to be, right? So address your ergonomics and your mechanics at home. Maybe it means that you need to change your seats. Some people, you know, they've showed me a picture of, you know, the chair that they're using, there's no back support, or the couch that they have, and it's just not supporting them in the way that they need anymore, right? Sometimes we wear out our furniture and it's time to replace. So stuff like that needs to get considered. Other things are, you know, the mechanics of how you're doing stuff. If there's something like bending forward is aggravating, and all of the pots and pans that you use are on the bottom shelf, maybe it's time that you put them on a higher shelf. These are the sorts of like day-to-day mechanics that you should be thinking about changing, just to improve your day-to-day life. And then I would consider strength building. I know that I kind of talked about the weak and the strong ones, but honestly, strengthening all of the muscles is a good start. Okay, so the exercises that I showed you would be a great place to start. But as you start to advance out of those, consider moving on to, you know, like a light exercise course, or, you know, a routine walk, that sort of stuff. And then seek treatment when you're injured, because far too often I have people that have come, you know, 10 years down the line, and they're like, yeah, I sit in a heavy machine, you know, heavy machinery, and my back's been killing me for 10 years. And we have to try to undo 10 years worth of change. It's just, it's possible, but it makes it harder. If you're injured, if you're feeling these imbalances, address them now. That's honestly like my advice is really start this as soon as possible. Okay, so that covers my lecture. I'm not sure how long that one took. Felt like a longer one this time. But yeah, you guys can always follow me on my Instagram. And then the Active Sports Therapy website that has all the different lectures that we do. You can sign up for the part 2, part 3, part 4 for this. And then if you or anybody you know wants to rewatch this, we do have a YouTube page where Renee will be uploading it. And again, if you want to ever book with me or you have questions, I'm at the Westman Village location, and that's the phone number there. You can always just come in, say hi. I'd love to chat with you guys as well. So if there is any questions, I'd love to answer them to the best of my ability.
Wonderful. Thank you so much, Dr. Evan.
Yeah.
We'll open up the floor to questions if there are any. And while they are coming in, I thought if you're new to our webinar series, what you'll get is a follow-up email. And in that email, there's going to be all the information of how to book with Dr. Evan, a link to the YouTube channel that you can share with friends and family. But I will be putting those 4 exercises that you put together in that email, in case you wonder or you were unable to grab a picture of that. So I'll just do a little screenshot. I took a screenshot while Dr. Evan was talking about those 4 simple exercises. If that is all you do every day or once a day, you will be able to refer to it through that email is what I'm trying to get at. So it will be there. I do not see any questions.
I don't think
if there are any, oh, sorry.
I don't think there is any.
I have a question.
So much.
One just came in.
Mm-hmm. I heard someone say I have a question, so we'll start there and then we'll go with the second one.
Yeah, when you're putting the hands on hips for the figuring out how level or where your level is, I don't really understand that. I don't understand the hand positioning where you can see where your hips are level.
Just pull up the image and I can help us through it again. Okay. So this is the one we're looking at. Okay. So is it up for everyone again? Can you see that?
Yeah, yes, I can see it.
Okay. So can you also see me? Can you see my body?
Yes.
Okay. So if you look at the bottom ribs, right, you can feel your bottom ribs through here. They start to round out towards the side. Okay. So I can feel my last bony rib right through here. Now, if I push lower down, there's no bones anymore. It's all just soft and squishy. There's nothing there, right? But if I slowly work my way down, you'll feel another bone. Okay. And that bone right there, that is the very ridge of what we call the iliac crest. So that's what I'm highlighting in red, and that's what I'm saying to put your hands on. Do you feel that?
Yeah.
Okay, yeah, so that's exactly, like if you think about it, you know, if you were to put a belt on, that's usually what we're trying to sit it on, is these upper hip bones. Does that answer your question?
Just the tilting part, I don't really understand
Oh,
how
the tilting. Okay, so the tilting part is if you have your hand on that bone, imagine that it's sitting more or less horizontal with the ground. Okay, so in my case, I'm already in that position. I'm neutral. I don't know, I can't see your body, but I'm going to kind of show you the different positions. One is if our core is weak and we start to let it tilt down, our pelvis is tilting around our hip joint. So this is the center of rotation, and we're tilting back and forth like this. Okay, you'll notice that my body isn't leaning forward or back to do it. It's all through here.
Okay.
Okay, so what you can do to practice that is, like, think about your back arching in and your belly sticking out in the front, and that's how we're tilting forward. And then to get out of that position, we're pulling our butt in, we're tucking our sacrum underneath our body, and we're letting our belly button come towards our spine, and that's the opposite rotation.
Okay.
Okay, does that help clarify?
Yeah, I believe it does.
Okay, perfect, thank you. Great,
Yeah,
great question.
Okay, we have a question. I'll read it as it was written. I have, and I may say it wrong, so I apologize. I have Piriformis syndrome off and on for several months now, and I'm doing all the exercises you were recommending, but wondering if there's something you could get that you can recommend for the pain that sometimes comes in the groin.
Okay, yes, so there is a stretch called the pigeon stretch. It's a great one to stretch out the piriformis. I'm just gonna look it up on Google to make sure I spell it right. Okay, so it is yeah, it's just pigeon, Pigeon stretch. And if you look that one up, it is a fantastic stretch for the piriformis muscle, and that could provide you with some relief. Now, if it's something that's been coming on and off and you've been trying conservative care, it might be time to consider coming in and seeing a specialist, because if you're doing all those exercises, we would expect it to be improving. Again, I would incorporate your pigeon stretch in there to see if that improves things. The other one that you might want to consider is a psoas stretch, because if the pain is starting to go through the front of the groin, we want to stretch that one out. And that one looks like a really deep lunge. In fact, I'm going to show you. I'm just going to point my camera down here. So I'm going to show you this is the pigeon one first. You start with the leg in front, and then as you come down, this leg comes in front like so, like that. Okay, so this is a pigeon stretch. Now this one would be stretching out my left piriformis, and I'm going to sink down into it and really give that a good stretch. Okay, so you'd have to do it on both sides. Then for the psoas stretch, for kind of, it might be included in your groin pain. Again, hard to say, but this might be beneficial. So you can try a deep lunge where you take a big step forward. And now that psoas is running from the front of the spine into the hip. So how do you stretch that? Well, you really push the glute forward and then you lean away. And that's stretching as much as you can through here. And that's a really good deep stretch. And you want to hold these for, 30 seconds or so and do a couple reps of them to really try to get in there. Okay, I hope that helps answer your question.
Yes, I think we got to thank you. I'm going to add one thing to that. If you find those stretches challenging on the ground, I love my towel when I do those stretches.
Yeah.
Grab a towel, put it under my knees, even if I have a yoga mat, just to give, so my knees don't get in the way of the pain, or don't cause pain in my knee. So yeah, it's that time of night, we're scrambling our words, but yeah, don't be shy if there's any kind of knee pain in those, because subtle pain, because towels really help. Simple towel from your bathroom. There's one more note. I think it was meant to say I have disc pain in my lower back as well as osteoporosis. Will these
Okay.
exercises help?
Okay, so I'm going to just kind of preface it because disc pain can be a lot of things. If you have a herniation, I'd be pretty careful about what exercises you do. If it's a brand new herniation and it's like really acute, I would say this is not the time to start those. If you've had it for a while, then this is something that I would start with, right? It's some gentle exercises that you can work into it, okay? I just want to preface, if the disc pain is kind of a generalized vague symptom associated with your osteoporosis, then by all means, yes. If you're starting to get stuff like pain down the, oh, it's dish. Oh, you have dish. Yes, you have the condition dish. Okay, okay. Yes, I would say that this is a place for you to start then. Definitely. Yep, I would.
Okay, Dr. Evan, that was so much information. What an amazing webinar. We're switching the lingo from lecture to webinar, so I have to pause when I say it. I think we have covered everything unless anyone else has any more questions. Thank you for your time. Thank you for your knowledge, Dr. Evan.
Yeah.
It's always wonderful to see everyone on these calls. There will be 3 more lower extremity webinars coming down the line. Just be sure to check your mailbox, email box, the first Friday of every month. And there'll be sign up available on the newsletter. You can always go online after the first Friday of every month onto the website and register there as well. I think that's all. Thank everybody for coming, and thanks, Dr. Evan, once more.
Of course. Thanks. Bye,
Have a
everyone.
good night, everybody. Bye.